Talk to you about some things that we're doing at the Middle Township Police Department in New Jersey. But first, let me share with you just a little bit of background and context about where I come from in my world. 22 years in law enforcement, 9 years as chief of police, master's degree in law public safety leadership, been to the FBI National Academy in Quantico, Virginia, and a leadership exchange fellow at the College of Policing in the United Kingdom. And all of my formal education and training has had a very strong emphasis on community, problem-oriented policing. And if you believe in community, problem-oriented policing, you understand that it's not a program, it's not a policy, it's a philosophy. And it's a philosophy where you engage partners in the community to get at the root cause of what's driving crime and social disorder. Now, I looked to what other police departments were doing to get to that root cause, and we adopted some philosophies. Enforcement, we have a category of enforcement, which is our traditional approach, and we're pretty good at it. But in my opinion, we need to be focused as much, if not more, in intervention efforts and education and prevention. Now, on our intervention efforts, we got a terrific partner, Cape Assist, where we put a trained drug counselor, social worker in our municipal courts, and when folks came in with charges, we were connecting them with services, substance abuse, mental health, housing, all types of issues to try to get at what I thought was the root cause of their behavior. Still important programs are going to continue. We also partner with a local church, Christians United for Recovery. The heroin epidemic, the opiate epidemic is one of the things that takes up a lot of my time, where we have recovery coaches that come into the field. Again, trying to get at what I thought was the root cause. Still an important program. Education and prevention, we're active in the community, public awareness campaigns, violence prevention, trying to give folks information to try to prevent crime in the first place. But my understanding of the root cause of crime and social disorder changed dramatically a couple years ago when I got involved with a grant through public health of all places. So the local hospital, the only hospital in Cape May County, came to me and said, will you be part of a small coalition to apply for a grant from the Robert E. Wood Johnson Foundation, one of the largest foundations in the world, Johnson & Johnson, who's based in New Jersey, for building a culture of health in Cape May County. They took me from law enforcement. They took Chris Kovic, the superintendent of schools in Lower Township, Greg Speed, the CEO of Cape Counseling, the largest provider of mental health services in the county. They took Vicki Clark, president of the Cape May County Chamber of Commerce, one of the most powerful chamber of commerce in the state. Tom Porotsky from the hospital, who's a vice president. And then we were required to have a coach, Vicki Lockman, who was on the board of Cape Regional. We were sent to Princeton. We had to go through 4 days of training through the Center for Creative Leadership. We were told to think outside the box and come back and figure out how we're going to spend $200,000 with the goal of building a culture of health in Cape May County. So when we came back, I got to admit, I didn't realize the commitment when I said yes to the president of the hospital to do this. But best thing I've ever done. Come back and we start asking ourselves questions. What's at the root cause? I went in thinking about the opiate epidemic, quite frankly. Chris Kovic, I know, was thinking about behavioral issues he's having in school, and everybody's thinking about what's going on in their little world, right? And then we came across the ACEs study, right? And I got to tell you, I was blown away. I thought that I had been getting at the root cause of crime and social disorder, but I really wasn't, right? This is the root cause. ACEs, adverse childhood experience, is the root cause of everything I'm dealing with, everything that Chris Kovic was dealing with in the school, the mental health, it was all connected. The problem was, I knew pretty clearly that, yes, this is the root cause, but I wasn't sure what to do about it. I said, man, this is a complicated problem. How is a police department of 60-some sworn full-time officers going to make a difference? But as I started to read more and I started to meet people like Mike McKnight, who's been a huge help, who lives in my county. Met Dr. Desatel. I saw her speak in January. I started to see there are things that we can do in law enforcement to make a difference.